So, sorry about that, internet. And this is where it's the pain when I travel because I don't always have the comforts of home. Anyway, so you're going to go to the ER, failure to thrive. If your child's not eating, your child's not eating. Wetting diapers every couple of hours. And again, I'm not a doctor. This is where you talk to your pediatrician. I don't care if it's Friday night, there's someone on call. If not, like I said, you're going to go to the ER and then you're going to tell them. When you're in the hospital for any reason, you ask for a consult for gastro. Why is this so important? Because now you're an established care patient unless they're a hospitalist. But if they have private practice as well as public practice, now you can get in, you can see them on Tuesday. If not, you might be waiting a couple of months. So there's some benefits there. Benefits is again, your number one priority is taking care of your child. And then, yes, it could be, violent allergies that they just can't even take the formula. A baby is much smarter than we are. And if their system can't take it, in a sense, it's like poison to them. And since they can't manage they'll just reject it if the formula is not working or something to that effect. That also can be an issue. So those are some of the things that you look at. But if you go in, I'm telling you, if you go in and you say, oh, I think it's Sanitas and so forth, they don't necessarily appreciate that you're telling them what's wrong. You're right to say this, but I would have more so a checklist. But again, reflux usually doesn't happen the second you eat it. That's absolutely rejection and so forth. That looks like incompatibility with the ability to do it. Is it structural? Is there a hernia? There's lots of things that can be going on. Social media is great, but the doctors are that way, and that's really important. Meanwhile, you get the reflux under control because now I can guarantee you if your child's that upset, not feeling well, they're not going to milestone because they're not feeling well. And that's where you come back here and we work on the milestones. But our babies really can go downhill quickly. I'm not trying to scare you. I'm just trying to be a practicalist. But if that's a word, it's Friday night and I'm tired. But you want to make sure that your child's taken care of. And if you have to go to the ER or 24-hour urgent care, but ERs are usually a bit better, especially at Children's Hospital because they're more accustomed to things like this. And get it under control to see what's going on, at least to calm their systems down so they're not looking at every bottle like I'm going to choke, gag, and vomit, because that's when they start saying, I'm not going to take that bottle. And that could be what is already going on. I hope that helps, but go down the checklist. Reflux, yes, but reflux is easy for them to give meds. Are they compatible with the formula? Is it structural? Again, go down it. Is structural here, aspirating penetration? Usually, again, my son aspirated. They'll vomit after the fact because it hits their lungs and it comes out. But not in all cases. Eosinophilic esophagitis, hiatal hernia, any kind of hernia, pylori valve issues. There's a lot of structure that goes on in the human body. And again, structural issues with the stomach. There can be lots of things. Social media is great. The doctors are that way. I really highly recommend you see someone as soon as possible, whatever you can get done. Peds are great, but they're not specialists, right? So if you need a specialist, that's what you need to do. Either ER to a direct specialist, or you're somehow getting seen by Tuesday. But again, it's Friday night. You've got Saturday and Sunday. Please don't hesitate to use facilities around you to help your child. Thanks.